This tutorial is in no way a replacement for any prescribed medication, nor is it intended to contraindicate or supersede any medically diagnosed conditions or designed to treat anyone or make any recommendations on deploy techniques as part of the treatment plan. This tutorial is strictly for educational purposes only. Psychological tests and screening. Psychological test selection has to balance two main factors. One, getting the most accurate and relevant measurements on probable problems without overlooking glaring issues, while two, using the shortest duration as possible to save cost and time for the appropriate professional and client. Therefore, screening tests are often useful as they are, per definition, quick and expedient. But always be sure to keep in mind the person's ability, culture, language, and age while selecting tests that are properly validated to suit those characteristics and setting and purpose, for example, in the clinical, therapeutic, or forensic environment. A few examples of the most frequently, or some of the most frequently used objective psychological tests are the Minnesota Multi-Phase Personality Inventory. The abbreviated version has 370 questions, takes 1 to 2 hours to complete, and measures a broad range of symptoms. The Wechsler IQ scales. The Wechsler IQ Adult Intelligence Scale has 10 core subtests that measure various aspects of intelligence, such as comprehension, reasoning, working memory, processing speed, and takes 60 to 90 minutes to complete. The Wechsler Intelligence Scale for children is used for children between the ages of 6 and 16 and takes approximately 50 to 65 minutes to complete. The Beck Depression Inventory, the BDI, is a 21-question, multiple choice, self-report inventory used to screen severity of depression. The BAI, the Beck Anxiety Inventory. The BAI is also a 21-question, multiple choice, self-report inventory used to determine the level of anxiety. The PTSD checklist, the PCL-5. The PCL-5 is a 20-item report measure that assesses 20 DSM-5 symptoms of PTSD. The Diagnostic and Statistical Manual of Mental Disorders, DSM, is published by the American Psychiatric Association and is the official classification of mental health or mental disorders in the US. In many other countries, the WHO, International Statistic Classification of Diseases and Related Health Problems, currently version 10 or ICD-10, which is similar to the DSM in many mental health respects, is used for diagnostic purposes. The Symptom Checklist 90, the SCL-90-R, is a 90 multiple choice self-report questionnaire designed to evaluate a broad range of psychological problems and symptoms of psychopathology. These are just a few examples of often used psychological tests and screening measures to pinpoint specific psychological symptoms. It is also typically used during treatment to determine the progress of therapy. Tests can be done once or twice during treatment program is to monitor progress, and again 3 to 6 months post-treatment to determine whether the treatment effects are sustained. In addition, treatment effects and diagnostic purposes, tests provide clues how a patient should be approached in interactions to build a relationship, which potentially interferences and could be expected, and the identification of focus areas and goals or case conceptualization.